So good morning, good afternoon, good evening to all our viewers, and thanks for being with us. We are here live from Geneva, from the Red Cross Crescent Council of Delegates, which is a place where we'll be discussing the vision and the plan for the Red Cross Crescent movement in the future. And today we will focus with my guest on the humanitarian situation in Lebanon and the incredible response of the Lebanese Red Cross. So first, we'll talk with Samar Abu Jaidi, and I'm sorry if I didn't pronounce well your surname, who is the head of movement partnership for the Lebanese Red Cross. So let's start from the current humanitarian situation. Can you describe how is the situation in the ground in Lebanon and how the Lebanese Red Cross is responding?
Thank you so much for this interview and for all the support. Allow me first to say that, as you know, the Lebanese Red Cross and country are the pioneer in responding with emergency medical service and blood bank. And with our support of our 17 national society partners in Lebanon, IFRC, ICRC, we are always to have a contingency plan and preparedness to be able to respond to any kind of scenarios. And currently, since the 8th of October, we've been responding, as you are all hearing on the news, with the bombarding that's been happening not only in Beirut, but also in the south and the Bekaa and many areas in Lebanon. And with the experience of the Lebanese Red Cross and the preparedness plan that we have, we are there to support first with the emergency medical service. So more than 165,000 missions have been done since the 8th until the 23rd of October. And we are talking about all kinds of transport, so not only responding to the injured from the bombarding, but also to the patients who are in need, the normal missions, evacuating hospitals, treating patients, also transporting martyrs. So we are there all the time, and also making sure of the protection of our volunteers, which are responding with a safer access that we have, though we will talk a bit later about different things. Also with the blood, we are providing the blood, like more than 59,000 component of blood were also distributed to the hospital, other than the mobile clinics and relief services that we are also providing to the IDPs.
Yeah, no, thanks a lot for this explanation. I have to admit that I've been myself, as you know, in Lebanon, and I really witnessed firsthand the incredible work of Lebanese Red Cross, and what we are seeing these days. It's really inspirational. I'm sure also very difficult for you. Can you walk us through the major needs at the moment? What people need the most, and also how I think that it could be very difficult even for the Lebanese Red Cross to work in that kind of environment?
Of course, as I mentioned before, the Lebanese Red Cross has a big responsibility in Lebanon, because we are trusted by the community in Lebanon, and we are also trusted by our partners, and especially the community. It gives us a high responsibility on responding to the needs. But eventually we are always coordinating with the stakeholders also in country, because as I mentioned before, we are leading in the emergency medical service and blood, and we need to provide and keep providing this service for the community. And we are supporting in terms of relief, because now, of course, what is always needed, and we have winter coming, is being able to provide relief items also to the communities, because IDPs now are inside schools. And of course, like you have children, you have old people, so you need to be able to make sure they have all the right equipment. Also for women to have dignity kits. So we are there to support with all of that. But what we say is that, unfortunately, what we are passing through in Lebanon is not something that is momentarily. So it is something that we need to have a sustainability in terms of supporting the community. So we just hope that we would do that and be able to continue and help any human being that is in need.
We heard about the possibility of shortage of supplies and even so all the items that you need for your work. How do you address these challenges? How do you see the future?
Yeah, actually, of course, what I was also mentioning, that with the support our partners, we are able now to do some international procurement, because in country, like for example, in the first 24 hours, you don't have like any matrices, you cannot find any matrices. Some reagents for the blood bank are not available. Some consumables for the emergency medical service teams to respond with are not available. And also, like if you have a shortage, all suppliers are like or asking for higher prices, or even like too long deadlines to meet and to get us supplies. And in a war like this, you cannot like wait. So here I thank again the support of our partners, which we are coordinating a lot with through the appeal of the Federation, especially, and with all our partners from the national societies, our back donors, to be able to see how we can together, of course, respond to this crisis and help each other in having the international procurement. Also for medicine, because you know we have primarily health where we are supporting and mobile clinics as well. And also we are coordinating this relief and response through our governorates and the operation room in the governorates with the government, where you have all entities working together. So I think now it's the time always to join forces and to see how, with the support of the partners, also how we can able to meet the response as much as possible.
Thank you very much for this, and I think that is a good way to introduce our next speaker and guest, who is our IFRC Deputy Regional Director, Christian Cortes. I mean, you have been working in Lebanon for many years, so you know very well the situation. Can you walk us through how the IFRC is supporting the life-saving work of the Lebanese Red Cross?
First of all, thank you so much. It's only to add what Sama was mentioning. From the starting of the hostilities in October last year, already IFRC was working to support in the preparedness components to the Lebanese Red Cross. And with the hostilities was increasing, and we passed from around 150,000 IDPs to 1.2 millions, 1.5 millions, our contribution is increased. So we support in the first 72 hours after last September with delivering of trauma kits for emergency was delivered to different hospitals in the south area, that is the conflict area, that was a very high needed, plus around 20 ambulances that they are already in place and they are working in the south and as well in Bekaa. So I would say this is from the operational side, this is how IFRC is trying to support. In the coordination side, I was mentioned by Samar, we have more than 17 national society in country, and our role is to try to facilitate the coordination together with them and to the national society and to the ICRC. You know, we will work very close, you know, with the ICRC, IFRC, Lebanese Red Cross, into addresses of the needs that we have now. That are tremendous, you know. Situation is changed very, very, very dramatic from one day to another day. Having people sleeping in the streets, that you never saw this before in all my years in Lebanon, Middle East. You know, people desperate in the street without any support, with anything to take care of themselves.
Yeah, and probably it's worth to say, and correct me if I'm wrong, but that our emergency appeal is also underfunded. So probably this is also a good occasion to call on partners and donors in supporting.
This is one of the situation that we are facing. We are underfunding of our appeal. We got a direct allocation and loan to after the September incidents, but nevertheless we are under funds. We have only around 15% of our appeal, and the needs are so huge. You know, we have more than 1.2 millions, 1.5 million people out of their houses. Only 300,000 are in community shelters. We have more than 1 million people in host communities, plus the economic situation of the country before the conflict is aggravating.
Yeah. Now, we touched briefly before on the protection and the issue of protection of humanitarian healthcare workers, healthcare teams. We knew that a couple of weeks ago, together with the Lebanese Red Cross and the CRC, we issued a statement asking to everyone to protect the health team. Can you tell us more about that?
Yeah, we have last week before our travel to Geneva a movement coordination meeting. We need to reinforce this message. We are collecting evidence also of the different incidents where Lebanese Red Cross is involved. Nevertheless, and to reinforce what Samar mentioned, Lebanese Red Cross is not only the more accepted organization in the country, but also for all parties. Lebanese Red Cross is the only organization that is working in the conflict area with a lot of high pressure and high sensitivities also, and with a high risk. The coordination that they are doing with the different parties through UNIFIL is very well done, but nevertheless we have serious incidents that, thanks God, didn't come to a extreme situation, but is increasing the number of incidents. And this is where we agree to reinforce our message, asking for protection of volunteer staff and civilians, and especially the health workers.
Yeah, and this is critical, and it has been an overarching message since the beginning of the statutory meetings, where really civilians and humanitarians must be respected and protected in every situation, in every part of the world. Now, before closing, I will just ask you, to both of you, something probably more personal, if you want, also to explain to the public what does it mean living in Beirut now and operating and really literally saving lives, but also supporting Lebanese Red Cross. And on a personal side, how is this difficult?
I can tell you that what you see on the news is a bit of what's happening in country. As we were mentioning, it's always hard to always think about family and friends, because Lebanon is a small country and we have friends in all areas. So when one area is hit, is very hard for you to see your friends, families, children who had houses living now on the ground, not able to have proper education. And always thinking when someone would be attacked or where is something that is very horrible actually to live. Nevertheless, talking about what we said, the protection of the volunteers, which I also want to highlight in terms of IHL and where we are now in this international conference and with all the parties here. So it's something to put actually into action, because until now we've had only, thank God, 13 injured volunteers, and we had 2 ambulances that couldn't move on site, they were broken. So even as Christian was mentioning, with the coordination that we are doing, with all the safer access that we have, with the trust that the Lebanese Red Cross and our access all over Lebanon, we are still being targeted next to us, and this is also breaking the IHL and our mission in terms of health providers. And we just hope it won't aggravate more, because our responsibility is growing towards the community. And not to mention, as Christian also said, since 2019 Lebanon has been going through crisis with the financial problems that we had, the inflation, the COVID, the Beirut blast. So we actually all still living in crisis since then. So our volunteers are there always to respond, and sometimes volunteers are going and also responding to their families. And we had 2 incidents of that. 2 volunteers went in the ambulance, they saw their family, their brothers who were deceased. And I cannot talk about it because it's really something very sad when you are there to respond to humanitarian mission and you see your family and friends which are injured on the ground. So we just plead to everyone and advocate that we are able to continue our mission, and that this will be over soon. And thank you for all the support of the movement, because without our partners, without the IFRC, ICRC, all of us coordinating in one voice, we cannot do our mission alone.
Thank you very much. I want to join your hope that this will really be finished soon.
From my side, a couple of things, from Lebanese Red Cross have 400 staff, 55 staff are IDPs already, families, and they continue working in the National Society 24/7. In the personal part, it's very hard to see your kids, they cannot go, they don't want to go outside because the sound of the drones is very disturbing. We have 24/7 drones all the time in our head. And when you have an airstrike, that they are very close, because Lebanon is a very small country. Beirut is very small from where we are in Hazmi office to the suburb of Beirut. So, and you need to explain to your kids that they are fireworks. You know? So this is very strong, and I understand how the population of Lebanon suffer, because this is very touchy. How you need to explain to your kids, you know, that please go out, you know, and they refuse to go out because they're afraid of that, you know. And this is in a personal touch that I have, you know. I am facing this issue with the family, and it's very sad, very hard to how to explain. But we continue, we're doing our best, you know. We have to put together with the Lebanese Red Cross, continue working with the partners, and to try that the situation improve as much as possible. Thank you so much.
Thank you very much, Christian, and thank you very much, Samar, and we will continue focusing on the incredible work of the Lebanese Red Cross in the next days and weeks. Thank you.
Thank you.
Thank you.
So much.
Thank you.